republic for which it stands.
Thank you to each of you for being here today. I want to begin by re-emphasizing a point that Senator Crapo made, and that is the irresponsibility shown in the titling of this hearing today. And as he said, never in a committee, never, to my knowledge, has the name of a presidential candidate been invoked in a hearing title, especially in such a villainizing manner so close to an election, which is 6 weeks from today. At the heart of today's discussion is a fundamental truth. It is that life is precious, and every single life at every stage is worth protecting. And when the Supreme Court restored the voters' right to have a say in their state's abortion policies, we began to see laws recognizing this around the country. Unfortunately, there has been widespread and misleading claims suggesting that these laws require physicians to wait until a woman is on the verge of death or severe and irreversible harm before they can intervene. No law in this country mandates that a physician ignore the needs of pregnant women in medical emergencies. Ms. Hacker, I want to come to you. Could you confirm if any states in America prevent physicians from treating women facing life-threatening complications during childbirth? And could you clarify how state laws allow doctors to act based on reasonable medical judgment without requiring imminent danger to the mother's life?
Yes, I can happy to, Senator.
Microphone.
Sorry about that. Thank you, Senator. Yes, that is true. Every state that has an abortion restriction has an exception that allows a doctor to perform an abortion in the reasonable medical judgment of the doctor if it's necessary to prevent the death or protect the health of the woman.
And do any states call for the prosecution of a woman who receives such care?
I'm not aware of any. Most states actually explicitly exclude the pregnant woman from prosecution, and other states, the way their laws are written, for example, Georgia.
Thank you for that clarification. I appreciate that. I think the misinformation that has been spread about state laws protecting life has created serious risk for pregnant women, even resulting in tragic and preventable deaths. It's critical that women receive accurate information. So can you address how the misinformation, particularly from the media and other sources, may contribute to unnecessary confusion, whether it's from providers or from patients, and fear in medical settings, and prohibit them from getting proper care?
Yeah, I think one of the Georgia cases is a good example of that, Ms. Miller. According to the article in ProPublica, she actually did not ever seek medical care after she took abortion pills that she ordered online. And her family told the coroner it was because of abortion laws in Georgia. But if she was afraid that she wouldn't be able to get care, the laws in Georgia specifically allow for her to be treated. And also the laws in Georgia do not allow for her to be prosecuted for taking those abortion pills. So that's an example of, if that's true, what it was reported, that she didn't seek medical care. It's as a direct result of legal misinformation.
Okay. And Dr. Francis, I want to come to you for just a moment, because I think correcting the misinformation and making certain that people get the care they need is vitally important. And Ms. Joshua, I appreciate how brave you've been in sharing your story. And I introduced the Woman's Right to Know Act earlier this year, which would set some long overdue medical standards that most states have already implemented so that women across the nation are provided access to vital information by their medical provider. It includes, number one, all the medical risk associated with an abortion procedure, and number two, the probable gestational age and development features of the unborn baby. and that this information go to the patient 24 hours in advance. So, Dr. Francis, how would this type of legislation enhance the health and safety of pregnant women?
Thank you, Senator. Well, one of the tenets of medical ethics is informed consent, which means that if a woman is going to make the decision to have an abortion, she should be given fully informed consent, be told about all of the risks, benefits, and alternatives involved with any decision. And so, we think that it's very important that women not only be given informed consent, but be given accurate information about the risks that they're potentially facing and have a personal interaction with a medical professional, not the way that it's being done right now where these pills are being dispensed online with no interaction. And women deserve to have accurate information about their state laws as well so that there will be no delay in them seeking care. And physicians need that as well so that they don't delay in caring for women experiencing miscarriages and other medical emergencies.
The time
Thank you,
of my
Mr.
colleagues
Chairman.
expired. Senator Cantwell will go next, followed by Senator Crapo.